As of yesterday, we had 2,417 cases of COVID-19 in Massachusetts. Those numbers have not been updated in Massachusetts yet, at least since I came down. But in Boston, we learned we're at 477 residents have tested positive. It's an increase of 113 cases since yesterday. And now 40 residents have had full recovery in the city of Boston of those numbers. Our numbers, we lost 2 people to the coronavirus, and 25 people in Massachusetts have passed away from the virus. And as we said the last several days, we hold all of the families in our hearts who lost loved ones to the coronavirus, not just here in Boston, Massachusetts, but throughout the world. These losses are heartbreaking, and it's why that we're all working around the clock to slow the spread of the virus and to keep people healthy. The federal relief package just passed the House. We look forward to being signed, and we will advocate for quick implementation of the provisions of that legislation. This legislation should help small businesses, people who are out of work, homeowners, renters, and many other different areas. I want to thank, in particular, our congressional delegation here in Massachusetts, who was instrumental in making sure that that legislation went through the United States Senate and the United States Congress. While we work to ease the economic pain of our country is feeling, we need to remember there can be no economic recovery without public health. That's why we're working to slow the spread of the virus, and it will remain our #1 focus here in Boston, in the Commonwealth, and in the country. We are fully committed to protecting all of our residents. Every life is worth protecting. A reminder, if you have experienced any symptoms, self-isolation is important, and call your medical provider or 311, and we can hook you up with the Boston Public Health Commission. The governor today announced new statewide resource for free online COVID-19 screening through Bowie Health. This company was founded at the Harvard Innovation Lab in Allston, which opened a few years ago. The Innovation Lab is now headquartered in the south end of Boston. It's a great example of how important our innovative community can be. They're providing free 24-hour online screening at bowie.com/mass. Bowie.com/mass. Based on your symptoms and your risk factors, they connect you to telehealth medical resources covered by your insurance. Again, that's Bowie, BUOY.com/mass. I want to remind everyone of their personal responsibility to help slow the spread of the virus. We have a stay-at-home advisory in place. That means stay at home unless you absolutely must leave the house. I can't stress that enough. The vast majority of people are following that guideline, and I want to thank you for that. But too many are still not taking that seriously enough. We are hearing and seeing large numbers of people in certain parts of our city not practicing physical distancing. We've seen groups of people playing sports in our parks. That's not social distancing. It's okay to step outside to get some fresh air, but if you must stay, and we're advising you to stay 6 feet away from each other at all times. This isn't about you. It's about your fellow neighbor. It's about your friends, about your family. If this doesn't change, I'm going to start naming locations in the city of Boston that this is happening in, so people will know that you shouldn't be there. We want to make sure that we're keeping everyone safe in Boston, especially our elderly population, people with underlying health conditions. The message is really clear. Stay at home. It will save lives if you stay at home and don't spread and don't have the virus, don't get contracted with the virus. In East Boston tomorrow, we're opening our first testing facility for Boston's first responders at Suffolk Downs. It will serve for qualified EMTs, firefighters, and police officers only. This is a joint effort between the Boston Public Health Commission and the East Boston Neighborhood Health Center. And I'd also like to thank Tom O'Brien for giving us a spot. It's an opportunity for us to start testing our first responders. First responders will be screened to make sure they meet the state criteria for testing. The pilot will start this weekend. This is an important step to keeping our first responders safe and healthy, and we have to do that because our first responders are our frontline folks. Students and families, the Boston Public Schools are closed. We're continuing to serve free meals every single weekday in more than 70 locations across the city. We've served over 100,000 meals since the program began last week. We're averaging about 13,000 meals a day. That number is going up every day. Many of our meal sites are also offering hygiene and menstrual products as well. So far, we've distributed over 20,000 laptops for at-home learning. Today, we started delivering meals to students who receive special education services and are unable to access our meal sites. Boston Public Schools is also providing supports to reach our English language learners with disabilities. I know that some of our families are worried that they will get in trouble if they leave their home. We want people to know you can and should go to get the meals if you need them. You will not get in trouble. Leaving your home to access food is an essential item. It's something that's important for you to do for your family. Just remember to keep practicing social distancing. To find the times and locations for pickup, we're asking you to go to boston.gov/coronavirus. Our senior population, we continue to reach out to our seniors to make sure they have what they need. A big focus right now is food access. We're getting people connected to Meals on Wheels program and food pantries. We're also giving seniors rides to the grocery stores and essential medical appointments. And again, I want to thank many grocers who have opened the stores earlier in the morning so seniors can have their time in there on their own. With our small businesses, we're continuing to support our small businesses. Yesterday, we hosted a couple of virtual town hall meetings. The first one with mayors from across the Commonwealth, where Senator Warren and Senator Markey explained the bill that was going through the Senate that was passed today. And yesterday, Senator Warren and myself hosted a virtual town hall conference for small businesses. We talked about what the relief bill will mean for people of Massachusetts and what the opportunities in that legislation is for small and local businesses. We've already taken many decisive steps here in Boston. We've lifted the ban on plastic bags. We helped restaurants and essential stores offer takeout and delivery. We've created online directories for what businesses are open, and we're asking the public to please access that website to see what businesses are open. So if you want to do some ordering some food and getting it delivered, you can take care of your local businesses. We're also creating a 5-minute pickup zone for cars in front of restaurants. Restaurants can request a pickup zone by calling boston.gov if it becomes a problem or calling 311. We have a few more traffic and parking updates for residents. Residents with valid resident parking stickers will now be allowed to park in metered or 2-hour parking spaces with no time limit or meter fees within their specific neighborhoods. So, for example, in neighborhoods that have meters and you have neighborhood parking stickers, you can park at those meters. Also, until further notice, the Boston Transportation Department will no longer be issuing tickets for expired inspection stickers or registrations. And I want to thank the registry and the legislature for helping us with this by extending, if your sticker is expired or your safety and your sticker on your license plate or your inspection sticker on the car, many of those deadlines have been pushed out so you don't have to go and get updated stickers right now. The city is continuing street cleaning. We are not ticketing and towing for street cleaning. Other parking meters are in effect to ensure public safety, and we're asking people to please don't park in front of handicap ramps, don't park in front of hydrants, and don't park in handicapped spaces. Those are spaces available for folks that need them. As far as construction goes, Boston has a temporary pause on non-emergency construction projects, and that still stands in the city. Like I said earlier, slowing the spread of the virus is our #1 focus, and it will continue to remain our #1 focus. We're asking construction sites and companies, anyone who has extra gloves, masks, or other protective equipment, if you could donate them to our local health centers. For information on how to donate, go to boston.gov/coronavirus. City services, we're continuing essential city services to keep the city running, but we have significantly decreased the number of staff here at City Hall. Most of our city services are now available online at boston.gov, and no one should be coming to City Hall or any municipal buildings unless they absolutely have to. Yesterday, we have a few additional departments that went to appointment only. The registry, the parking clerk, Age Strong, the election department, the city clerk's assessing, collections, the bid counter at public facilities, and inspectional services. All of those services now you'll have to call in and make an appointment or do it online. Make sure you call ahead to see what's available. And you can find all the information about all these departments and the status of these departments at boston.gov. Like I said earlier, one of the most important things that we can do right now as people is stay home. But the reality is not everyone has a home. To all of our homeless neighbors, we want you to know that we are working around the clock to protect and support you. All of our shelters remain open. We have conducted regular deep cleanings and sanitizing in our facilities. Our street outreach teams are still working every day to engage the people who need them. And I want to make a special thank you to our street outreach workers who are on the front lines and doing incredible work, making sure that our homeless population is getting the attention they need and feel safe. We are creating facilities where people can quarantine, receive care, and recover. 2 of those locations opened this past week next to our shelter in the South End. They provide space for people quarantining and receiving medical attention. We are currently working with local institutions to add more locations for quarantine, care, and temporary housing in Boston. We expect that these additional locations will be operational in the next week, and when they are, I will announce them. We are working closely with the state to repurpose the Newton Pavilion at the Boston Medical Center. We will temporarily reopen to meet the needs of the coronavirus-related medical needs of homeless residents. The capacity we have right now there is 250 people. We're also staying in close contact with people who are formerly homeless. We know that in this is a very hard time for people, and we want to make sure that everyone has the supports they need to stay healthy and stay housed. Earlier this week, I announced $2.5 million in grants for health care for the homeless, Pine Street Inn, Boston Medical Center, to strengthen healthcare system for the homeless population. I want to thank those organizations who have been doing incredible work around the clock here in the city of Boston. These organizations were some of the first to receive money from the Boston Resiliency Fund, and we are still accepting donations at boston.gov/resiliencyfund. I also want to make sure people know that the city is hiring for important positions, including homeless counselors, public health advocates, and public safety officers. We're asking you to go to the Boston Public Health Commission's website at bphc.org. That's bphc.org for job listings, and as soon as you get your information in there, we're going to get you interviewed, and we're moving quickly on that. Right now, lots of people are worried about housing security. The first of the month is coming up, and the city is working hard to ensure that both tenants and homeowners can stay in their home during this crisis. We have worked with housing advocates, property owners, and the Boston Housing Authority to halt eviction proceedings, and we appreciate the state following suit. It may also be possible to defer your mortgage payments. I know the banks are working on options right now, and I'm recommending people call your lenders to ask them the question. If you don't call the banks and put yourself on notice there's nothing they can do after the fact. They've told me that. So we want on credit cards and mortgage payments, make sure you call the banks to see about deferments. Our Boston Home Center also remains open to provide guidance. For more information, we're asking people to go to homecenter.boston.gov. Before I open it up for questions, I just have one last message for the people of Boston. This is a very challenging and difficult time for a lot of us. I'm asking people to be kind to each other. This is an unprecedented public health emergency. Many, many people are stressed. Everyone is doing their best. It's never been more important that we support each other. And remember this, the virus doesn't discriminate, neither should we. This is not a time for scapegoating. It's not a time for stigmatizing anyone. We've heard about bullying, harassment, and racism around our country. I certainly won't stand for it in Boston. It's not who we are. It's also important to remember that we can't get through this crisis without our immigrant neighbors and their contributions. 16% of all healthcare workers in the United States are immigrants. 36% of all home health aides in America are immigrants. 29% of our physicians in this country are immigrants. Immigrants are providing other essential services, as well as 70% of our grocery and supermarket workers are immigrants. 18% of our food delivery workers are immigrants. We are all in this together, and we all depend on one another. The vast majority of people are showing what our city stands for. I've been incredibly proud to see the acts of kindness and generosity. Last weekend, we saw 1,000 volunteers show up to help bring information to every single home in the city of Boston. People are finding ways to stay positive and lift each other up with creativity, with humor, with hope. The recovery community are doing AA meetings online, and I suggest anyone to call Central Service. They can tie you into those meetings. As a matter of fact, tonight's going to be the first time I'm going to do it, a virtual AA meeting, so I'll let you know how it goes. I want to remind you that every single person has the power to help. And I want to personally thank all of our medical staff, first responders, frontline workers. I want to thank our press, the camera people, the photographers, the reporters who are out in the front lines delivering us the news in situations that I know they'd much rather be home with their families. I urge everyone to treat them all with kindness and patience and respect, including those who deliver our mail and our packages. We show what we're made of in these hard times. Now it's time for us to show what Boston's made of. I want to thank everyone for doing their part. I want to thank the counselors that are with me today, and I want to thank the counselors that we've been on a daily call every morning with the Boston City Council, talking about how we can move forward. I've been talking to the state delegation, the state reps and state senators. We are all in this together, and it's important we're going to get out of this by being together.